Welcome back to another episode of Bite Back. Teeth, that's the easy part. Being a woman in dentistry, now that's a whole different story.
In today's episode of Bite Back, we will be talking about what we didn't learn in dental school. And there's a lot. I feel like the list of what we didn't learn is longer than the list of what we did learn.
I agree.
I don't think we came out ready. We did not come out ready. I have a funny story. I was in 5th year and I remember I just learned, I think I was following David Schiffenhaus, somebody, and they were talking about onlays. And my pros lecture in 5th year, and we're on Zoom during COVID, obviously, and I thought, you know what, I'm going to ask him about it. So turn off my mute, put on my camera, all these comments. I'd practiced it. Thought, I'm going to ask him. He's going to think I'm so good. I was like, hey, excuse me, can I ask about the onlays and bonding them and, what's your opinion on that? I got torn into pieces. It was like, what are you talking about? You don't know what you're talking about. And at the end of the class, he said to me, he's like, thanks, Amelia, for amusing us today. Now I look back and I'm like, we don't do crowns much anymore. A lot of it is onlays. But, it's just such old school thinking at uni. And then we came out having to learn a lot of things ourselves. So surrounding yourself by colleagues that are at that, a really high level, and having mentorship really does matter. Put the clinical side of things aside. What else did we not learn?
Well, I felt like I left dentistry just knowing dental basics. I knew how to do a general exam, how to identify where cavities were, how to diagnose a tooth if it needed a root canal, how to do a root canal somewhat, prep a crown, all that sort of stuff. I felt like I knew how to do that, just not to a high standard, right? But there was a lot of shortfalls and a lot of things that I left kind of having to figure out myself. One of the big things was communicating with patients, how to have really difficult conversations with them, how to talk about money. I went from not earning $1 while I was at uni to now I'm charging someone $200 to do something. Yeah. And that change was quite a big one and a difficult one. And it took me a long time to feel like I deserved to charge that $200 for the checkup and clean or for the filling or whatever. Yeah. So we really weren't taught communication well. You
weren't taught that you're not worth it. I almost felt worthless finishing dental school. Kind of felt like, oh my gosh, I don't know my place. I don't know what I'm doing. And I don't feel like I'm good enough.
Yeah. I feel like uni put the fear of God in me. So every time I did something, I was fearful that something would go wrong. Yeah. So if I was extirpating a tooth, I was worried that I would perforate or break a file in the tooth. Yeah. And then I was like, what are the consequences of that? I'm going to get into a lot of trouble. Yeah. The patient's going to be unhappy. The patient's going to be in pain, or the board's going to come after me. So every time I did something that was bigger than a filling, a lot of stress came along with that. And I carried that for years. I carried it for so long. And I think it took me so long to get over that. And every time I would think back, I'm like, that's what my professors kind of instilled in me, that fear. And I don't know if it's across the board or just my university in particular, but that's how I felt leaving. I was just fearful of everything. And it's probably why it took me so long to try do Invisalign, because I was just like, what's the point? I'm just going to get into trouble for it, or the outcome's not going to be great. And then they did teach us how to refer things off. Yeah. So it's if you're referring everything off, how are you going to upskill?
Exactly. Yeah. Can I ask, how do you feel like you overcame that and got to the next level?
I forced myself to do more treatment. Yeah. And if a patient came and they didn't want to be referred off, they couldn't afford it, I had to do the treatment. Yeah. It's not like I was going to hand it off to anyone else. Yeah. So, it was slow. It was a slow build-up. The more you did, the better you felt. And then I felt like the more years I was treating as well, realising, things aren't coming back to bite me in the butt. Yeah. I'm doing okay. The recalls, I'm looking, I'm like, my treatment's still good. Yeah. Fillings are still great. The root canal isn't reinfected. Yeah. The crown hasn't cracked. Everything's looking good. So I think it was time mainly for me. And actually doing communication courses as well did help. I remember I did do the Prime Speak one, and I felt like that kind of opened the doorway for clearer communication, clearer treatment plan and communication, stuff like that. So I think if people are struggling, doing a course is helpful as well. I'm sure there's many others out there. I've only done Prime Speak myself, but then I've also learned a lot of communication through my mentoring at DB as well. So
it's so true though. Mentorship does matter. Like, you know how people always go, mentorship matters, that little hash. It really does. Like, it's so important.
Yeah.
I feel that surrounding yourself with like-minded clinicians, but also clinicians that are going to push you to that next step. When you come out of uni, that's what I think is really important. The courses, but the mentorship.
Yeah. And the mentorship's hard to find. Like, I didn't find it until I got to DB. So it is one of those rarities, but I think continuing the search for it is really important.
Yeah.
Yeah, because it kind of propelled me into being like an even better dentist, an even better communicator, being even better with my hand skills. So yeah, all of that kind of naturally came together with someone guiding me along. Because there's only so much you can take from courses, and it's hard to sometimes implement things yourself, and, you know, so having someone there who's done the treatment or whatever, it makes a huge difference.
I agree. And, you know, I remember we're starting at DB, we had like a 2-week training program, and I remember thinking, oh my God, this is wild. Like, the amount of things that we got taught in that time, in particular about communication, it's changed the way I think, the way I do, the way I speak.
Even the way you carry yourself as well, or sit, or...
My goodness, it's...
Even
like chalk and cheese from when I first started. I was so timid, and no one would believe this now, but I really was. I was scared of my shadow. I was scared of my shadow. And now I'm a completely different person, and that's thanks to the mentorship and surrounding myself with people like you. And now that you mentor, you get to bestow that on people like the younger generation.
Yeah.
And I think that's what's really, it's making sure that we do give that younger generation the ability to flourish like what we did.
It's definitely rewarding, but also I think sometimes I'm like, am I doing a good job? Am I doing enough? Maybe the men don't think that way, but I do.
Self-doubt. We always have so much self-doubt.
But yeah, and then like, you know, you've got that imposter syndrome, like, am I the right person to be giving this person all this, you know, all this information and all these tips and stuff?
But that means you care.
Yeah.
I think that means you care, exactly.
Yeah. If you could go back and give your uni self some advice, what advice would you give yourself?
I wish I had done courses when I was at uni. Like, courses don't need to start when you're a dentist. Courses can start when you're at dental school.
Yeah, I 100% agree.
It's like, imagine if we had surrounded ourselves with like-minded people whilst we're at uni. We probably would have pushed ourselves more and not been as timid. I mean, you know, it's easy to say now. Who knows what it would have been like, but I really think that taking courses back then would have prepared me so much better. It's 5 years. You know, some people it's 8 years at uni to do the course and the degree. That's, I'm not going to say wasted time, but imagine if you could project yourself into, you know, a higher standard by doing those courses. So I think that's really important because, you know, we always say don't just do one course, do all these different courses because you learn different ideologies, you learn different ways of doing things from different people. Same goes with uni. You're at one uni, you've got one set of teachers, one set of lecturers, one set of ideology. You're not hearing it from different people. So I really think if I could go back, that would be the biggest thing.
What courses would you tell yourself to do?
I would definitely do communication one. I would probably do a treatment planning one too. Because I would say that's the biggest thing. Like when I have new grads come and watch me and I'm, you know, talking to the patient and in that 30 seconds, I can tell them what they need.
It's like rapid treatment planning.
It would have taken me 2 hours back in the day.
Yeah. And days. And then you'd call the patient back,
days.
And then you'd have another consult. But now it's like boom, boom, boom. This is like, these are the options.
Yeah. So I think if that was focused on more at uni, it would make people feel more comfortable and confident leaving. Because you just don't have that confidence when you leave. Yeah. You always second guess yourself. But, you know, during that 5 years, that's so much time. Think about like all that. That's all. 5 years is a long time that you could be using and spending, you know, although it's obviously a bit like there'd be money that you'd be spending, it'd be money well worth spent.
So yes, the courses are really expensive, which is probably why a lot of uni students don't do them. But there are more financially reasonable things that you can do. So there's like, you know, the Spear Education and all of that sort of stuff that you can do online. And I think it's like $300 a month.
Oh, wow.
And you have a whole, because I did it during COVID, there's a whole library of things. They cover every aspect of dentistry, like things that you don't even, like you can't even imagine. Even doing stuff like that, like they do communication, they do how to achieve the perfect root canal, they do how to achieve the perfect aesthetic result, how to do a full mouth rehab, like all of that's on this big library. So you can even access, you don't necessarily have to go in person to do this one course.
Yeah.
You can access other things.
Wow.
And I know there's like RIPE and
Wow.
all the other ones,
Or
which
maybe
I
that's
haven't
something-
done myself.
You know what?
but-
Maybe it's something we should do. Maybe we should
Yeah.
start our any people in dentistry, if they want help, let us know.
Yeah.
We'll start a course for you.
Just add an extra thing to our to-do list.
Because we're not busy enough
Yeah.
already. I do feel that people coming out of dental school think that their hand skills are going to be like what ours are now. I'm like speechless because I kind of think back to me like leaving dental school, being like, yeah, like my hand skills, they're always going to stay like this. But that's not the case. It just, you progressively get better. And I think that's where the difference between theory and practical comes from school as well.
And it's just time and doing more and more and more. And with time, most people's hand skills get better. I think there's a small percentage of people who, like, they reach their peak.
Right.
And the peak, they can't break through it.
Okay.
But yeah, I think, time.
I do think they teach a lot of theory at school. Probably, in my opinion, too much because the job isn't. I guess this is maybe a bit of a controversial topic, but for me, it's more hand skills than theory. You know, you can know all the theory and all the books back to front, but if you can't do it and put it into practice, it's...
Yeah, well, the theory is useless then. Yeah.
Correct.
If you can't achieve a great outcome.
Yeah. So I would say that, I think if I had my time again, I would probably practice more on models. Probably would take the initiative a bit more. I mean, that's me knowing now, you know.
In hindsight?
In hindsight.
It's a lovely
would be
thing.
great. Yeah. You know,
Yeah.
we've got the models, like perhaps practicing my composites, practicing things like that.
Yeah.
That would have been something that I would do more of. Go to SimLab a little bit more and just practice and practice and practice. Because at the time you don't realise that how important the hand skills are. You're so busy studying for your exams and the theory and useless stuff that you'll never ever use again. But that's something that I think is not taught enough.
But also when you graduate, you can still practice in your downtime.
That's
'cause
true.
Who comes out of university with full books?
Yeah.
It's very rare. And
True.
if you are lucky to have that, that's amazing. But if you're not, using that downtime to upskill and to progress so even practicing your composites, practicing whatever in your spare time.
I don't think it's spoken about enough though. I mean, maybe that's just me, but I don't think people do it enough. I think in first and second year, they don't practice enough. They just think, it's almost they're too scared to show that they need to practice. I think it's really important, you know, finding a mentor. So you still have those models, you know, prep the teeth or do the composite, go show your mentor. Ask for advice, message people, you know, find a community that, you know, you feel comfortable to ask the questions. I think it's still really important. I mean, I still use my models. You know what? Even with really, really difficult surgeries, we still 3D print our models of the skull.
And then do it like a little...
Just in case.
Yeah.
You know, there's no harm in practicing and there's no harm in going, you know what? This will be better than me just going straight and doing it on a patient.
Yeah. Well, even with the newer dentists that do join, my first thing I say to them is, in your downtime, practice your composite veneers.
Yeah.
And then come and show me.
Yeah.
And some of them take that on board really well and do it, but then there's others that just don't understand why I'm asking them to do that. And then they start to do the veneers. And then the temporaries look terrible.
Yeah.
And they wonder, why do my temporaries look terrible?
Yes.
You don't know your anatomy. You don't know how to achieve even line angles, or, you know, you don't know how to fix a cant. You don't know how to see a cant. So anything in dentistry, the more you practice, the better you get.
Yep.
But especially with something like aesthetics where someone's seeing it and nitpicking at the treatment that you've done, it's really important to know how to fix things if a patient's unhappy with them.
Yeah. Thank you for tuning in to our episode of Bite Back, where we spoke about our experiences at uni and what you can do in life after uni to become the best dentist possible.
As always, scrubs on, doubts off, and we'll see you in the next episode.